So in this video, we're going to be taking an integrative approach about the cardiovascular system, and there are three topics regarding this subject matter, and these are going to be changes in gravitational forces, exercise, hemorrhage. I'm going to be dividing this into three videos. So in the first video here, we're going to be talking about changes in gravitational forces. So let's go ahead and do that. First, there are six factors to this, and I'm going to go ahead and go through each one of them first, then we're going to go to a figure, and then finally summarize it into a table. So before we go into what happens when we move from a supine position into standing position, first I want you to know that the responses to changes in gravitational forces such as exercise, hemorrhage, they demonstrate an integrative functions of the cardiovascular systems. That's why we're tackling it in these videos. So first, when we talk here about the changes, which is number one, changes in the gravitational force, the following changes occur when an individual moves from, like I said here, supine to standing position. Okay, when a person stands, as a number one, let's look at what happens. When a person stands, a significant volume of blood pools in the lower extremity because of the high compliance of veins. Okay, so veins have high compliance, and that's why we have a volume of blood pooling down there. And muscular activity would usually prevent this pooling. Okay, as a result of venous pooling in general and increased local venous pressure, the PC or the capillary hydrostatic pressure in the legs increases. Okay, and the fluid is filtered into the interstitium. Okay, so what would happen when we get fluid built up in the interstitium? We talked about this topic before. And when we get fluid in the interstitium, the net filtration, if it exceeds the ability of the lymphatic systems to return it to the circulation, we will have edema. So if you have a person who's standing for a long time and not getting, and the blood is pooling in the leg and the blood is not returned to the heart to do its job, then we can get edema. Okay, then moving on, venous return decreases. As I just told you, venous return decreases. As a result of the decrease in venous return, both stroke volume and cardiac output, they also decrease, and that's due to the Frank-Starling relationship, which I talked about in a previous video. Moving on, the arterial pressure, we would also expect it to decrease, and why is that? It's because of the reduction of the cardiac output. I just told you the cardiac output is decreased. If the cerebral blood pressure becomes low enough, then sometimes we can get fainting. So people that stand for a long time without moving in one certain position, they can faint. Okay, compensatory mechanism is the carotid sinus baroreceptor. So what happens in compensation when we are standing for a long time and we get venous buildup? We have the compensatory mechanism. It will attempt to increase blood pressure in order to normalize it, because the blood pressure is not normal when you're standing for a long time. And the carotid sinus baroreceptors, which I'm mentioning here, they respond to the decrease in arterial pressure. How do they do that? Remember, stretch. Okay. They sense low stretch, so they respond to the decreased arterial pressure by decreasing the firing rate of the carotid sinus nerves. Okay, a coordinated response from the vasomotor center then increases the sympathetic outflow to the heart and blood vessels, and therefore decreases parasympathetic outflow to the heart, and as a result, hopefully, heartbeat or heart rate, contractility, total peripheral resistance, and venous return will increase. Okay, and then the blood pressure will increase towards normal, which is what we want. Okay, well, there's this concept here, number 6, which is called orthostatic hypotension. What's that? Orthostatic hypotension is fainting or lightheadedness on standing. Okay, and there is something called orthostatic change, which is more important to know, that if we have a decrease, if a patient comes in and has a decrease of 20 millimeters mercury on the systolic or 10 and the diastolic, that's considered orthostatic change. Also, a decrease of 30 beats per minute, that's also a change, and we call that orthostatic hypotension. It may occur in individuals whose baroreceptor reflex mechanism is impaired. Let's give some examples. That would be such as individuals treated with sympathiolytic agents, which break down the sympathetics, the sympathetics are not working as it should. Well, let's bring it down and sum it up in a figure. We have a person here standing. The blood pools in the veins, and when the blood pools in the veins, the arterial pressure decreases. Therefore, we have a reflex, which is by the baroreceptor. What does it do? What does it compensate? It tries to increase the sympathetic outflow. How does it do that? And the heart increases heart rate, increases contractility, increases cardiac output. And the arterioles, what happens is we have constriction of arterioles, okay? And we also have constrictions of veins in that sense. So when we constrict arterioles, we have increase in total peripheral resistance, and constriction of veins, we have increase in venous return. And all of that hopefully will return the arterial blood pressure to normal. And another form for you table lovers, arterial blood pressure here, the initial response to standing is decreased. The compensatory responses towards normal increase it. Okay, heart rate, really there isn't an initial response, but compensatory response as part of trying to bring the blood pressure up is to increase. Cardiac output is decreasing initially when we're standing, the compensatory mechanism increase. Stroke volume is also decreasing initially when we're responding to standing, we have increase in compensatory response. Total peripheral resistance is really not affected when we initially stand, but as part of increasing the blood pressure, we have increasing compensatory response. Center of venous pressure is low, increased towards normal. Okay, so now that ends this video. Next video we'll be talking about exercise and its integration and its role in cardiovascular system. Thank you for listening, and please leave me feedback.